What is the Declaration of Helsinki? The Declaration of Helsinki is more formally known as the Code of Ethics on Human Experimentation of the World Medical Association. It is a statement that provides guidance to physicians and researchers, primarily on constructing experiments involving the use of human subjects. The essence of the declaration was the need for subjects to be informed of the benefits of the study before even consenting to participate in the research.
The original iteration of the Declaration of Helsinki was drafted by the World Medical Association Committee of the Medical Ethics under the leadership of Dr. Hugh Clegg and Dr. Antonio Spinelli. The document was shared for criticism and review with the national medical associations of 102 countries, such as the American Medical Association for the United States. The Code of Ethics on Human Experimentation of the World Medical Association was adopted by the World Medical Association at the 18th World Medical Assembly in Helsinki, Finland, in 1964, which would later be referred to as the Declaration of Helsinki.
The Nuremberg Code is the predecessor to the modern-day Declaration of Helsinki. Formulated after the end of the Second World War, this code established 10 ethical principles to which physicians and other healthcare workers must conform when carrying out research on human subjects. It is now accepted worldwide. The Nuremberg Code was the first official document that brought the concepts of voluntary participation in research and informed consent into the public eye. It is also merely a set of guidelines which form the ultimate skeleton of the Declaration of Helsinki itself. The World Medical Association utilized the 10 key points of the code to flesh out a more detailed blueprint that could explain each point more in depth. While the Nuremberg Code focuses on the human rights of research subjects, the Declaration of Helsinki focuses on the obligations of physician investigators to research subjects, according to Schuster. The Code's origins begin on December 9, 1946, which was when the Nuremberg trials took place. These trials were held in order to hold accountable the 23 German physicians and their facilitators for the war crimes they had committed against prisoners during World War II. The primary charges involved in the formation of this code were the allegations that Nazi physicians had conducted medical experimentation on concentration camp prisoners without their informed consent. Many of these unfortunate patients became permanently disabled in some way or even died from these treatments.
The Tuskegee syphilis study was a major influence on some of the revisions of the Declaration of Helsinki, namely those involving informed consent and access to the most efficacious treatment interventions at the conclusion of a study. The reason being, the researchers conducting the Tuskegee syphilis study deliberately failed to treat participants with penicillin after it was established as a treatment and cure for syphilis.
The Declaration is widely perceived as both a set of ethical precepts and as a guide to the protection of human rights in human experimentation. The patient has the right to self-determination and the right to informed consent regarding participation in research, both in the beginning and during the research. The investigator's duty is solely to the patient. The researcher should protect the health, life, privacy, and dignity of human subjects. The patient's well-being must always take precedence over the interests of science and society. The research should exercise greater care to protect subjects from harm in non-therapeutic research. Research should be based on a thorough knowledge of scientific background, a careful assignment of risks and benefits, have a reasonable likelihood of benefit to the population studied, and be conducted by suitably trained investigators using approved protocols, subject to independent ethical review and oversight by a properly convened committee. The researcher should conduct research only when the importance of the objective outweighs the inherent risk and burdens to the participants.
So who is required to follow the Declaration of Helsinki? Really, it is not a legal document. It is, however, the gold standard for ethics, and most institutional review boards abide by the Declaration of Helsinki. Therefore, if a study is in violation of this declaration, it gets denied until ethical issues are resolved. When this document was first adopted, it was said to primarily focus on physicians. The goal was to create an ethical provision for physicians to follow regarding their research and care done to their patients. It requires the patient or participants of research to know any risks and benefits about care or research being done with regards to them. However, this document is also considered a soft law because of its influence on the drafting of international and national/legal documents and legislation which may implement its provisions.
The Declaration of Helsinki has had 7 revisions since its inception in 1964. The first revision in 1975 focused primarily on prioritizing the safety of research subjects over the interest of the scientific community, and also establishing what would later become IRB. The second through fourth revisions in 1983, 1989, and 1996 focused on acquiring consent for minors. The fifth revision in 2000 primarily focused on establishing the ethical groundwork for exploiting developing countries by performing research in areas where the medications being studied would not be available economically, and also that upon completion of a study, participants in both treatment and placebo groups must be given access to the most efficacious intervention suggested by the evidence of the study. The sixth revision in 2008 primarily focused on establishing 2 exceptions for testing a novel method against the best current method. The first exception is that there has to be no prior proven method. The second exception is that if a placebo is used, the placebo must be supported by rigorous methods and pose no harm to the participant. The seventh revision established a need to make research results available regardless of if it has a successful or unsuccessful outcome. It also provides a requirement for participants that sustain injuries directly related to a research study are provided compensation. And also it reinforced the need to ensure access to a proven intervention if suggested by the evidence of the research study.
The American Nurses Association, in combination with the American Association of Colleges of Nursing, have drafted 2 documents that have foundations in the Declaration of Helsinki. ANA enacted a position statement entitled Education for Participation in Nursing Research. This position statement was retired in June 2010 in favor of a new revised position statement called The Nurse's Role in Ethics and Human Rights, Protecting and Promoting Individual Worth, Dignity, and Human Rights in Practice Settings. The second statement brings the topic of human rights to the forefront and provides nurses with specific actions to protect and promote human rights in every practice setting. This is according to the ANA. The AACN drafted the position statement Nursing Research that discusses topics such as the scope of nursing research, scientific integrity, importance of a research-intensive environment, and challenges and opportunities of future nursing research. It is this complex relationship between the building of a body of science, the utilization of knowledge from multiple disciplines, and the application to practice and health policy that presents opportunities and challenges for the academic nursing community, according to the AACN. Research studies that require human subjects as its participants must receive ethics approval by an institutional review board, or IRB. The law that established the IRB was also known as the Common Rule. Nursing research will most likely involve human participants and need to fall under IRB for approval. A human participant is any person who may directly or indirectly be involved in any sort of medical research. In order to be a participant, they must be informed of any risks and possible benefits that might result from this research. A personal example in my life was when my mother was receiving a new and still experimental drug. It's called Natpara. And as our future nursing career, we might choose to work for a company like this that is releasing these medications. They're completely new, and we would serve as educators for these drugs. These drugs are still in a testing phase and have yet unknown side effects or potentially serious complications that require full consent of the patient. When my mom received this drug, she had to be approved. She had to sign a paper form that stated that the rats used in the studies had gotten bone cancer. It was a higher dose than a human would ever receive, but she still had to be informed of that possible risk and sign off on it, that she understood. A special nurse is then hired, and she comes to the house and demonstrates how to take the drug and inject it and everything, explains the known side effects, and lets the patient know to report any odd side effects they might receive from the drug. You must leap over many hurdles to use it, even with a prescription.
This is an actual patient handout from MPS Pharmaceuticals. It illustrates the hurdles of the approval and education process the patient will have to go through to start their experimental drug Natpara. The IRB at Columbia University, in compliance with the Declaration of Helsinki, approved the clinical research by MPS Pharmaceuticals into the testing of Natpara on human subjects for the replacement of parathyroid hormone.